Florence Namfuka, a resident of Kagoromoro, Mugoye Sub-County in Kalangala district, is an HIV patient. To sustain her life, Namfuka takes ARVs on a daily basis. But she recently ran out of her drugs, and yes, she has to travel 18 kilometers to Kalangala Health Center for. Namfuka uses about 20,000 Uganda shillings to collect her drugs by a boda-boda. However, since Tuesday, Namfuka has not been able to collect her drugs due to the travel ban.
Boda-boda tumwagalako muntu munnewe kakati lwaki nze malayika ngazi agenda okufuna ARVs ku ddwaliro ngazo noonya obulamu bwange lwaki ati mubusima.
In her failed effort to beat the public transport suspension, Namfuka got several strokes of cane.
Nze ndiwa ARVs malayika kakati ati bankubye emiggo kati ngenda kola ntya emiggo gyennuma ARVs zikola ki nazo zimmanja.
Namfuka is not alone. Thousands of Ugandans who are supposed to access ARVs were left stranded.
Many of the people who need the life-saving antiretroviral drugs and those needing TB drugs have to walk miles and miles to collect their refills.
Dr. Stephen Watiti is the chairperson of people living with HIV.
And I've lived with HIV for over 30 years, probably 35 years. There are about 1,800 and over 1,800 ART centers in the country, all over the country.
We are saying in all health centers, we let people be given, because at this time, we are at an uncertain time.
Currently, about 1.4 million Ugandans are HIV positive, despite government efforts to fight the disease.
The coronavirus coming doesn't mean that the HIV is going to wait. Remember, HIV is still a threat to our country.
Number of new HIV infections is by end of 2019 was about 50,000. So we are making progress, but it's not as fast.
Experts say if an HIV patient is attacked by COVID-19, the effects could be worse than those of an otherwise healthy person.
And people living with HIV are one of those, because when your immunity is down, then your ability to fight disease is reduced.
And remember, if they don't continue swallowing their medicine, the viral load, amount of HIV in their blood is going to increase, and these are the people who are going to infect new people.
However, the Uganda AIDS Commission is devising guidelines.
That's the guidance that we are outlining, and we should be able to share it with the people, especially people living with HIV, and we are working with the Minister of Health and then the district officials by end of this week.
Dr. Lydia Mungerera says the current guidelines issued by the President are against the confidentiality rules reserved for people living with HIV and AIDS.
Are we really having confidentiality for these people? Are we really not having an increase in stigma coming up?
Of course, the conflict would be now confidentiality, because you come from a given community, and we know the stigma and discrimination associated with living with HIV. So if you go to your chairman, the local chairman, there are the issues. So that's what I'm still consulting with that constituency.
Jingo Francis, NTV.